I'm Al McFarlane. Welcome to Conversations with Al McFarlane. First, thanks to our sponsor. Our sponsor is North American Bank. Thank them for their support of the organization. My guest today is Dr. Inell Rosario. Dr. Rosario is a board-certified ear, nose, and throat surgeon and sleep medicine specialist. She's the owner of Andros ENT and Sleep Center, Andros Audiology, and Andros Med Spa. Born in the Bahamas, she came to the U.S. to attend Macalester College in 1983 and subsequently attended University of Minnesota Medical School and the Medical College of Wisconsin for her ENT residency. Her clinic is named for the island, the Andros Island in her native Bahamas. She's all about heritage, and that's one way of reflecting and honoring the heritage that has given her wings to fly. At her clinics, she sees both pediatric and adult patients and has a sleep lab on site. Dr. Rosario and her staff aim to treat all patients with the same care and respect they themselves would like to receive. She calls that my kind of care. Dr. Rosario, thank you for being here.
You're welcome. Thank you for having me.
Well, you're doing such a phenomenal work in connecting around your specialty. Describe, first of all, the work of the Andros clinics.
So the main clinic is the ENT and Sleep Center, and especially living in Minnesota, you get a lot of issues with sinuses, with ear infections, with sore throats. And so a big part of our business is managing the ear, nose, and throat health of people. Mm-hmm. So everything from ear infections in kids, which is important to manage and treat, not just from a pain standpoint, but from a language acquisition. So if they're not hearing as well, then they're going to be behind in speech and language. So paying attention to that. And from a tonsil adenoid standpoint, looking to see, are they having issues with infection or are they having issues with sleeping? It's been in the news. It's no secret at all. When kids are having issues with adenotonsillar hypertrophy, they're much more inclined to have neurocognitive issues, and that can be everything from behavior as far as hyperactivity, attention deficit, but you get the other end of the spectrum too, where they will have more issues for anxiety and depression because they're not sleeping well because their tonsils are obstructing the airway. We'll also see that manifested in their facial growth and development, where they'll have more issues with malocclusion. We do the sinuses and allergies. The sleep medicine is, right in there, very near and dear to my heart, because I truly believe it all starts with sleep. If you're not sleeping well, nothing else works, whether it's your blood pressure, your hypertension management overall, your cardiovascular risk. So, and then I have the med spa, of course, where everybody's got to look good. So we do some of the more fun things there, so to speak.
I saw a flyer earlier. Oh, here it is. Let me look at some of the things that you're presenting in the med spa, Andros Med Spa. And you're actually having an open house.
Yes.
In a few days, April 11th, I think, 4 to 11 o'clock. And
4 to 8.
4 to
8 p.m.
8 o'clock on April 11th. Thank you for correcting me on that. But talk about the products and services, the business of the Andros Med Spa.
So I started the business 4 years ago, and a big part of it, obviously being a female, I look like this, an African-American woman, trying to find products that actually I think look good on me, and as well being able to service multiple different racial ethnicity was a big part of that. Every man and woman want to look good, and also wanting to have a little bit of control in the ethics of it, so that really focusing on having a place where people can go and get the answers without feeling any pressure to buy or that they're being talked up in what to purchase, but just straightforward. And our motto there is enhance, rejuvenate, and create your beauty, where really want to take that person and make them the best of themselves and more confident to do whatever they're going to do. And my goal always is that nobody knows what you had done. So if you had your lips done, and I can tell you had your lips done, you had it overdone, in my opinion.
Okay.
So wanting to keep people looking very natural. So we carry.
So you do the surgery.
I do the procedures.
And when it's done by you, you won't know it's been done.
Correct. That's my goal. I also have a really talented nurse injector that works with me, Heather Lance, and she's also same philosophy. We want to do it and not have people know that you had it done. It's like, oh, what happened? You look refreshed. And that, when my clients come back and tell me that, then I know I've accomplished my goal, that they look great. So just kind of that younger version.
Yeah. So it's not just vanity anymore. It's really just becoming your best self.
Absolutely.
And there's nothing wrong with vanity either, I think.
No, we need more of that. I think if we had more of that, people would pay more attention to their exercise, their health, and would live longer and live better lives. And hopefully we would have less issues for anxiety, depression. You know, you hit the gym as opposed to kind of focusing too much on what the problems are. So,
Okay.
yeah. And we carry all the SkinCeuticals, Skin Medica. We carry the Zoe line from Obagi. We have Cool Sculpting. We have True Sculpt. Pretty much anything you need for looking better, we carry.
Are your businesses all located, co-located, or separate locations, or how do they work?
The Med Spa is in a separate location in the Village in Mendota Heights, and the ENT clinic is in Inver Grove Heights, right off 52 and 494.
Okay.
Yeah.
And so the ENT clinic has the other two businesses? Or?
Correct. The ENT clinic has the audiology department and as well the sleep lab. So we have an overnight sleep lab.
So I'm fascinated by your entrepreneurship, number one, but also just the field of medicine that you've chosen. How did you choose the field of medicine? And as you were doing the study, preparing to become a doctor, a physician, a surgeon, was there also a commitment emerging to entrepreneurship?
So for the medicine part of it, growing up in the Bahamas, I grew up very poor. I didn't see it as underprivileged because I didn't know any better. And I've always,
You just
thankfully,
had what you had.
I had what I had.
Yeah.
That was it. And thankfully, I've never had the mindset of being poor. And I worked hard always and was reasonably smart. And so when I came to the U.S. and wanted to go to college, a big part of that was I definitely want to make myself better, make my family better, and I thought I'd go to medical school. And in being in medical school, always knew I wanted to do something surgical. I liked doing things with my hands on the wards. I was great at doing needles and everything else. And so looked at neurosurgery versus something else. And neurosurgery was the draw because I had a sister that had a brain tumor. And I always thought the doctors were so arrogant. It's like, okay, I'm 12, but you could tell me it. I'll understand it. And so I wanted to make sure that when I talked to my patients,
They just presumed that you wouldn't get it.
I
if they
wouldn't get
taught
it.
you, yeah.
And so when I talk to my patients, I always want to make sure that even if they're a 3-year-old that I'm doing tonsils on, I talk to their level. But anyway, going back to choosing neurosurgery, they didn't really have a life outside of medicine, and I wanted to have a life. So then I thought, well, I could be an ENT doctor and work with the neurosurgeons. And of course, I do general ENT. I do work with them sometimes, but that's how come I chose ENT. Of course, it was a little difficult because I didn't realize how much snot is involved. So we really are the booger doctors. And so
Real
for a
snot.
while, real snot. So I always tell the patients, you can just tell me about it. You don't have to bring it in.
Right.
So I was like, doc, look at what I blew out. I'm like, thank you very much.
boy.
No, thanks.
Yeah,
So that's how I ended up with ENT. This more wanting to be surgical, wanting to be head and neck, and then I thought neurosurgery would require too much personal time. Like I couldn't see a commitment outside of that. Being an ENT, it's definitely the right specialty for me. It is so varied. Most people don't realize that your plastic surgeons are ENTs for the most part for your head and neck. So I can do the cosmetic side, I can do the not so fun side with cancers, and everything I say nipples up, I'm fair game.
Okay.
So
then when did you decide, and how did the entrepreneurial path sort of envelop your desire to be a physician and a surgeon?
It was definitely always just the medicine.
Okay.
The entrepreneurial side started in residency as far as like looking at the different models or structures of practice. And I always wanted to have as few barriers as possible between me and the patients. And so even when I came right out of residency, I worked in a private practice group, and then from there started my own. My family history, on obviously a different scale, I have a sister that sells fruits in the Bahamas, and I have some patients that have, because she's right on the main street on Bay Street, so I have some patients that have taken pictures with her and gone, hey, here we are with your sister. So, and I have a brother that owns a business there. So my family have always been entrepreneurial on their own level of selling and providing and not waiting. As a little kid growing up on Andros Island, I, strangely enough, don't know how to swim very well because I was the youngest. And so as the youngest, my role was to stay home and count. And so counting means my brothers and sisters would go out, fish, get crops, but in particular the fish and the turtles. And we lived in Mars Bay, the very last settlement. So we would have all the turtles lined up on the road, and my job was to number them. And the guy would come down in his truck, and I would give him our order of here's how many turtles and fish we're sending to Nassau where they would sell. So then I knew how much money we would be expected to come back. So that was my role, and the older kids went out and fished. So I learned to count and be responsible right away. So maybe my entrepreneurship started then.
Yeah.
So
That's a great story. And so advice to people in our community on a couple of levels. One, just to pursue, I think, STEM training, science, technology, engineering, the technical knowledge that you've developed as a physician. How important is it to prepare for that, and how should we talk about embracing opportunities in arenas like that? That's number one. And then the same thing about business, entrepreneurship. I'm interested in encouraging our people to begin to see ourselves as entrepreneurs, as business owners, so that we define ourselves that way. What do you think?
Absolutely agree that we need to do more, and part of the reason why I'm here. And over the past 22 years that I've been in the state, I've been doing this all along, trying to get the word out there. I've gone to everything from grade schools to tell kids, here I am, ask me a question about being a doctor. Believe it or not, the number one question I always get is, how old are you? Because people believe, well, if you're a doctor, you have to be old and you have to look mashed up or whatever, and you're not so real. And so I was at one of the schools in St. Paul, and that was, I think, the half hour of questioning for part of it.
How old are you? Right.
Yeah,
because so young.
They don't believe that you could go through all the schooling. So the schooling is not bad. But anyway, I think that for kids that are interested in medicine, certainly looking at the STEM programs that are out there, but overall just being involved in your community and doing your homework. There's, you've got a balanced life, that it's not all play. Sports, I think, is really, really important to participate in. It really helps you to be able to balance the work in college and your schoolwork. And it also teaches you to fail, because your team is not going to win all the time.
That's right.
And so you figure out how to rebound and rebound again. And that's the same is true in business, because even when your business is going great, not every aspect is going to go great. And having had that idea of I failed at something and I had to pick myself back up again and start over. So I told my kids too that life is very much like basketball.
What sport did you play?
So I ran track. I was a runner.
At McAllister?
No.
Before.
And McAllister, I was way too type A. Like, let's study. We're gonna pass this. in high school and junior high school.
Okay.
I ran the 100 and the 200 and the 400. Probably my best was the 100.
What's your vision? What's your long-term vision for your company? I'll have you close on this. But what do you want the Andros system to emerge into? Andros Med Spa and the other companies, your Andros Audiology and Andros ENT and Sleep Center. What's the big picture? What's the big vision for you?
Big picture is to get a partner and expand. I would love to take our model of very hands-on, direct patient care, educating patients to multiple areas in the state and even to other states, and have that same model where patients know that they're going to come and receive the education that they need about their health care so that they are participating in the health care. I think my biggest compliment was from a patient that was in a car accident and was having some orthopedic issues and came to the front desk to make an appointment, and the front desk is going, "No, Dr. Rosario doesn't do that." And she said, "I know she doesn't, but she will tell me who I should see."
Where to go?
She will get to the bottom of it.
Sure.
And that's the kind of care that I'd like us as a group to be able to expand and have multiple other clinics that just listen and service the patient, educate them.
Super. Dr. Inell Rosario, thank you so much for being here. It's been a wonderful interview. Good to meet you. And I look forward to learning more about your services to collaborate with you at Insight News and through our Insight to Health Fitness Challenge. There are some ideas I think we can do together. Let me remind people that your new, not so new, but the Andros Med Spa is located at 750 Main Street. Is that it?
Yeah.
Suite number 109 in Mendota Heights, Minnesota. And the phone number is 651-222-3127. It's 651-222-3127. There is a spring open house coming up from 4 to 8 p.m. on Thursday, April 11th. Come by, check you out, and see what's going on there.
We'll have food and wine.
There we go. All right, thank you so much.
Great.
I'm Al McFarlane. This is Conversations with Al McFarlane. Let me say that to me this conversation is so important simply because we, again, focus on this question of self-reliance and entrepreneurship in our community. And I think what Dr. Rosario is presenting is a model for quality care, for business that works. She says, she calls it my kind of care. And she's also talking about replicating that and recognizing our ability as community to be entrepreneurial and to serve ourselves and to do that and make profit at the same time. So, Doctor, thank you so very much.
You're very welcome. My pleasure.
I'm Al McFarlane. This is Conversations with Al McFarlane.